As Highland Park healthcare workers reflect on the horrific events of July 4th, they're searching for ways to heal.
Medical reporter Dina Bair continues her exclusive interviews from Highland Park Hospital.
They rallied to treat the physical wounds of that day, but knew they would very soon need to focus on the emotional toll of the mass shooting, the loss in the community, and the quest to make sure it doesn't happen again.
When I walked into the hospital, what I saw was something that I never expected to see ever in my life. There's a lot of crying and what's happening, where's my loved one?
And it's what we train for, but it's that anxiety of they just keep coming.
The painful recall of the exact minute mass casualties began arriving at North Shore University Health System's Highland Park Hospital.
I didn't even think about crying, truthfully. You can't. You were almost numb for a couple days, truthfully. But you can't. You don't know, is there going to be a round two, right? So that was the other thing. Are we safe? Is he one of the patients?
On that day and a week later, the focus is on the impact of the trauma as the team meets to assess performance and support one another.
And at that point, you're treating for the injured really physical, but also emotional wounds. Mm-hmm. People had to be frightened and traumatized.
Yes. And that was just it. And they're thanking us, which grounds you. And they're thanking us for doing our job.
We're focused completely on how could we take care of the patients we're here? How could we try to make sure that patients felt safe? And how could we do whatever possible to salvage life and limb for every patient that came in? And in that moment, you don't really think about yourself. You're thinking about how do you serve others?
These are professionals who are used to dealing with trauma, who are unflappable, but they're also human.
Yeah.
And there must be some emotional toll.
Absolutely. People who work in healthcare, you're kind of trained to deal with trauma and to be able to cope in the moment so that you can put your own thoughts and feelings and fears to the side so you can take really good care of that patient or family who's in front of you. But then after that patient has already transitioned and you've done your work, then you're left to think about what does this mean for me and what just happened in my community.
Your team is your family. And every nurse just says you're fine, but we've realized, I mean, we are okay. We have support here with each other, but it's also okay to say you're not.
And that is the message to the community. It's okay to ask for help.
Everybody responds differently. There's no one way to react or make sense of trauma when it happens. When you're directly impacted by a traumatic event, actually the closer in proximity to the event that happened, the more likely you are to actually develop PTSD later in those first couple of weeks.
With a number of people outside, our emergency department inside, blood on the floors.
Highland Park Hospital President Gabrielle Cummings, who guided her team on July 4th, is now paving the way for mental health providers to aid staff and others in the community.
So I was moving in and out of hospital president to operational leader to food service team member to transporter to charger getter. I remember running down the hallway to get chargers because the families needed chargers for their phones. So it was a very fluid and dynamic day. You know, I think just from a mental health and awareness perspective, how it'll change us is just being much more aware and sensitive to one another's needs and what people are saying when they're not speaking, and making sure that we're listening and connecting with body language outside of what some of the verbal cues are.
The key to recovery is to look for and address signs of trouble. Psychologist Dr. Lindsay Fazio knows she'll be busy.
We think of both the short term and the long term. So in those first couple of days to hours, we usually see people that are just in total state of shock and disbelief, and usually experiencing a lot of anger as they try to figure out what they've just lived through or experienced. And then over the next couple of weeks to months after that, we start to see people really process what they've been through. And you may see more, changes emotionally, like being more irritable or sad or depressed, starting to have trouble with their sleep. We also ask people to stick to their routines. So as much as that's hard to do, so getting out of bed, taking your kids to camp, going through the motions of your day that you normally would to try to provide comfort in the mundane of our routine.
A shooting at a family parade is anything but routine. But experts say we should be routinely thinking about how trauma affects children and ways to prevent them from spiraling.
It sticks with you. You know, it's life-changing. But people can go through treatment, they're very resilient, and they can, you know, go on to have meaningful, joyful lives. The sooner you have a concern about your child, the quicker you're able to act, then the more support and quicker support that child's able to get. And in the long run, we know that that's very helpful. So as soon as a parent has that feeling inside, like something's not right, something's happening, definitely they should talk to their doctor, seek the help of a mental health professional.
And that's even more critical if you believe someone is a danger to themselves or others.
If you have a concern, then I'd recommend sharing it with someone who's trusted, right? Either someone in law enforcement or someone in healthcare who could then help you navigate through what to do with that information.
Do you anticipate that in this community especially, we're going to see more people seeking help?
I sure hope so.
Some have said the shooter did not carry out his planned attack due to a mental health problem. It was an act of hate. But experts say the anger is typically born from pain. And prior to that, there are many calls for help. It's up to all of us in every community to listen. Back to you.
Our thanks to Dina. Still healing the community. Well, still ahead, Elon Musk's Twitter deal comes crashing.